Hello, Dionna. How are you?
I'm good. How are you?
I'm okay. I
Yeah.
certainly recognize you, but you're more mature now. You're older. I first saw you when you were what, 9 or 10 years old?
No, I had my stroke at 14, and after that, I went to your clinic 5 times actually.
Yeah, you came in first for your arm.
Oh, I had pediatric OT, and
Right.
then I had the second time going down, um, I had speech therapy, well, intense. And then the third was intense OT. And then the fourth one was um, my intense leg therapy. And then the fifth one, intense OT again. Yeah.
Well, you're certainly speaking very fluently.
Thank you.
Congratulations. You kept up.
Well, thank you so much.
I'm just delighted to see that. And please
I
give my
am
regards
not,
to your mother.
oh, yes. I am not reading 100% yet, but I'm getting there.
Good. Tyler told me we never did work on your reading, did we? We just worked on your speech.
Yeah, but I went to intense reading and writing therapy in Marquette University in Milwaukee, Wisconsin, um, uh, 6 times for my reading.
Good. And so now you're uh, an intern in public health.
Yes, and I am going to graduate in May for my bachelor's in public health.
Yes,
And I am getting my master's after that for social and public policy and advocating.
good for you.
Yeah.
That's marvelous. It warms my heart.
Thank you. And I was volunteering at the brain injury unit at the our hospital. But the quarantine was upon us 2 years ago, and after that, the not go to the unit. But I volunteered at the brain injury unit for 4 years.
What unit?
I'm
I'm
sorry?
sorry. I'm sorry. What you said you volunteered?
At the brain injury unit at
Oh,
the local hospital
marvelous. Good. Good for you.
for
You're
four
paying
years.
back.
I'm sorry?
You're paying back.
Yes, yes. And I am driving to
Oh,
with
marvelous.
my medications in my car.
I'm just so delighted. I think of you often, actually.
So
Actually, I
young.
do. I really do. I speak of you because, it turns out that you were one of the first two people that we started doing intensive follow-up with. So when you left here, were speaking in a very improved fashion. But after you left here, you kept improving. You did, because we took data on that, we took information on that. And I'm pretty sure that that was because we maintained contact with you. If
Yes.
you
I had the fourth or fifth time I went to Milwaukee, Alabama. The red hair girl, I can't remember her name, did like the like it was like 4 or 5 years like after that therapy.
Michelle Haddad.
Yes, Michelle, yes. And it was like 4 and 5 on the like code, like on the paperwork. And but I let's see, 4 years or 5, then I go to Milwaukee, Alabama, sorry. And um yeah, that was in high school.
Right.
Yeah.
So what she did was she called you and she spoke with you and gave you the communication activity log
Yes, that. Yes.
for an hour. She spoke with you for an hour and a half, once a week for the first month, and after that, once a month for the next 2 years. And I believe that keeping the need to keep speaking as best you could and keeping that in mind, so her continued contact with her, you knew that she was going to contact you. She contacted you, asked you what you were doing, checked on how, what we say, compliant, how adherent you were to keeping practicing with your mother. And as a result, well, one way or another, you kept improving after you left here.
Correct.
And so that's what I think about. We're starting to do that with all of the people who we work with now. Is your success there, your continued improvement after the end of treatment. That doesn't happen. Hopefully during therapy you improve, but you don't improve after the end of treatment therapy.
Well, and it was so long. It was like 8 years ago, and my stroke happened 10 years ago. And I find that speaking every day with somebody is good.
Right,
Basically.
right.
Yeah,
You use it or lose it.
exactly. Yes. Yes. Exactly. Yeah. Yeah.
So after we're done, I actually just yesterday completed the trailer for the documentary. So I'll send that to your email so that you can watch that. Um, and I think everybody's super excited to see the whole journey that Dionna has come along. And you're a big part of that. So thank you for everything that you've done in giving Dionna her life back. Um, that being said, I know a lot about it because Deanna's told me. However, could you explain to us what constraint-induced therapy is and how that works?
Sure. Well, we began our work with monkeys, and we surgically abolished sensation from an arm in a monkey. And we left the motor innervation intact. And the monkeys stopped using the arm that we had removed sensation from surgically. That procedure is called a serial dorsal rhizotomy. That's for the record. And so that was a classical observation in the history of neuroscience, made first by Sir Charles Sherrington, and that provided him with the basis for his dominant, well-known reflexological position that all movement was based on spinal reflexes. What we had done was abolish, what he had done is simply abolish sensation, hadn't touched motor innovation, so he asked, why should the monkeys not use the arm? And his answer was, what he had done was eliminate, abolish spinal reflexes. And he came up with the idea then that all movement was based on the operation of serially interacting spinal reflexes. That's a little technical, but that's the way it was. So we came along, that was in 1895. We came along in late 1950s, and we said maybe we could use behavioral techniques to force the monkey to use the limb. And so we did. The first thing was rather crude, which was we restrained the use of the intact forelimb. And we also trained the normal forelimb, the good forelimb, the intact forelimb, with behavioral techniques. One of them is called shaping. And that, and we did that with the affected arm. So we restrained the affected arm, the intact arm, and we trained the affected arm. And within a week, the afferented monkey was using that limb effectively. He was clumsy. We had abolished sensation from the limb, but there was no class of behavior that he couldn't do. He could do it, but it was clumsy, but he could do it. So that did two things. First, it demonstrated that the Sherringtonian reflexological principle was wrong. Couldn't be correct, because these monkeys without any spinal reflexes were nevertheless walking, climbing, picking up small objects between four fingers. Now, at that point, nobody spoke about what you did with monkeys as rehabilitation. But that's really what it was. We had rehabilitated the use of this injured forelimb. So when I got to UAB in the late 1980s, I thought, why don't we try that with human beings? So we started out doing exactly what we had done with the monkeys in human beings. We started out with adults, and then we went to children and teenagers, and it worked just as well in humans as it had done in monkeys. So we started with monkeys, and when we brought it to humans, we called it constraint-induced movement therapy. We didn't call it restraint-induced movement therapy, but constraint. By constraint, what we meant was we discouraged strongly compensatory behaviors. That is, what the monkeys and human stroke patients do is use the good arm to do the work of both arms. So they stop using the affected arm. That is done over and over repeatedly. And what happens is they learn to not try to use the affected arm. And that happens in human stroke patients also. The second thing we do is we encourage normal use of the affected arm. Now, the use of the arm isn't affected, use of the affected arm isn't normal, but we try to get individuals to do the best they can and to keep trying. Because another thing that we learned early on, starting in some research I did in Germany, where I set up CI therapy clinics, 4 of them, and then back here at UAB, is that what CI therapy does, it produce a massive plastic change in the brain, a plastic reorganization, which we never demonstrated with Donna, but many other people who got exactly the same treatment that Donna did. What happens after stroke, for example, is the part of the brain that is involved in moving the limbs shrinks by a half. And what CI therapy does is it forces the individual to use the affected arm, in this case arm. I'll get to generality of it. But the first thing that we did with Donna is work with her arm. And so by forcing use of the more affected arm, the brain starts changing. So that after 2 weeks of CI therapy, if you look at the brain again with magnetic resonance imaging or MRI, the motor cortex, the part of the brain that is responsible for producing movements of the affected arm, has doubled in size. It's gone back to normal size. Its function isn't normal because the function of the arm isn't normal, but it's greatly improved. And that's because CI therapy forces use of the affected function, which produces a massive brain change, which makes use of that function easier. So it's used more, which in turn produces a further change in the brain, which makes use of the affected function easier still. So you get this great feedback loop between improved function, improved motor function, improved neural function, further improved motor function, and further improved neural function. Okay, so you get this feedback loop. We used restraint of the good arm with Donna and other people, but we also trained her affected arm, the arm affected by the stroke. Those two force use of the affected arm producing the brain change. We've done this in many patients. We never looked at Donna's brain, but I'm sure that's what happened. You got a growth of actual growth of tissue in the arm representation in the motor cortex of the affected arm. Okay. And we worked with the leg, and I think we worked with Donna's leg as well. There, we didn't restrain the good leg because then Donna wouldn't have been able to walk. She would have been hopping on one leg. So what we did is we just, if Donna remembers, discouraged using her compensatory affected leg movements. And we tried to train her to use normal leg movements, normal patterns of walking and leg use, maintaining balance. It was discouraging compensatory use of patterns of walking and insisting that she go back to attempting normal patterns of walking, which she couldn't initially do. But as she tried, the walking became more and more normal. The next thing we did, and this is all a development over a period of years, is say, if this works for the arm and the leg, maybe it'll work for speech affected by stroke, aphasia. And so when Donna came to the laboratory or treatment setting, we asked Donna not to use gestures, which is typically what people with expressive aphasia do. Instead of talking, immediately after stroke, the speech areas of the brain can be affected, not in all patients, but many. And that's called aphasia. In the initial period after the stroke, there's something called cortical shock or spinal shock. After stroke, it's cortical shock, where you get a loss of excitation. There is then a spontaneous recovery of excitability in the nervous system, which over time makes some preliminary, rudimentary use of the impaired function possible. That's not possible in the immediate post-stroke period, but slowly becomes possible. But by this time, the individual, the patient, has learned a compensatory pattern of behavior so that they don't try to use the affected function any longer. We call that learned non-use. That becomes a very powerful inhibition of attempts to use the affected function. So after a while, the person who really could use the arm, the leg, speech, but they never try. So with CI therapy, what we do is we try and force them to use the impaired function, whether it be the impaired arm, impaired leg, or impaired speech. We try and force them to use it, and we strongly discourage their using gestures. So when Donna first came to us, she was speaking of sentences of like 1 or 2 words. And not trying, and to express herself, she would use gestures. She would point, like if she wanted a glass of water, she would point to the glass of water and the mother would bring it to her, or she would use facial gestures to say, well, I don't like that, or I do like that. So, or she would use gestural utterances like or aha, or when she tried to speak, she would use sort of stock phrases like oh my, or gee, or she'd say 1 or 2 words and then say, in order to simulate normal speech, she said gee. Well, we wouldn't permit that. She couldn't make meaningless locutions. She had to say words. She couldn't say them very well. That was fine. She had to keep trying. And as she kept trying, she was able to do it because the speech areas of the brain, or the arm areas of the brain, or the leg areas, had become excitable without her realizing it. So she could do it in rudimentary fashion. And when she started doing that, brain feedback loop came into operation. And there was a gradual reconstitution or improvement structurally and functionally of the speech, the damaged speech areas of the brain, so that by forcing improved speech, even if it's 1 word, 1 more word, had an effect on the brain, which made speech easier, so she started using 3.5 words in a sentence and 4 words. And as she was using more words, that use was producing increased change in her brain, which made still further improvements in speech possible. And that kept on going, so that when she left here, she had gone from maybe 10% or 11% of normal speech, according to the measurements that we take, to 50%. Then Michelle Haddad kept contact with her. And what Michelle Haddad was doing was reminding her, either by giving her the behavioral inventory of 12 different types of speech activities, or just reminding her to keep trying to use speech. Don't go back to using gestures, pointing, grunting. Even though it's hard, and it's very hard, so that, I mean, Donna deserves a medal. This is really intensely effortful, right, Donna? It's really hard. It is hard. So, but the point is that the individual receiving the therapy is doing it themselves. Normally, you go to therapy and you're approached by a therapist and who goes zap, and you're rehabbed. That is, he asks you to speak or use your arm and he guides it. But with CI therapy, that isn't the case. There is a therapist there and they're a guide, but what the therapist is doing is different than the typical therapist. What the therapist is doing is trying to get the patient to be their own therapist, to get the patient to do it themselves. You've never heard this discussed on this theoretical level, have you, Donna? You've never heard heard the therapy that we administered to you discussed on this theoretical level, I think, have you? But that is what we did, and that's how it works and why it works.
Well, you are a great person to interview because you answered all 4 questions that I had, and I didn't even have to ask them. So it doesn't stop, from what I'm gathering. It doesn't stop after therapy. Dionna can always continue to improve. And I think her mom and her aide and myself do a wonderful job not letting Dionna take the shortcuts and come up with it on her own.
That's the heart of the matter. And this isn't the end of the road. First of all, there's maintenance, or what we call technically retention. Because if you don't keep trying, there's always the possible of sliding backwards. But if you keep trying, you can keep improving, because it will continue having an effect on the brain. So I'm not sure whether you'll ever become a Demosthenes, or I will. I'll never become an orator, and maybe you won't either. But your speech is like 98% normal, 95% normal, I think.
When I'm talking to Dionna, it's mostly brain farts, and she has to think of the word, but she eventually gets it. And
Right.
so it's amazing. When I first met Dionna, she might have told me, but her speech and her behavior and her movement was so normal that until I met her in person and was interacting with her for a while, did I really see that she even had a stroke.
Right.
And her mom, the first time I met her mom said, it's almost as if you're interacting with somebody where English wasn't their first language. And that's how good Dionna's speech and everything has come.
So this is very rewarding for me. And actually, I'm a scientist, so that my real payoff is conceptual. It's deciding to do something, making predictions, doing it, and seeing whether the predictions turn out to be true, and whether you can then do an experiment that will demonstrate to others. You do it repeatedly enough times and you get the same result, people will start believing that that really is what you're claiming to be the case is the case, and that's scientific truth. And but along the way, stories like Dionna's are very rewarding, very rewarding.
Well, I had that therapy in Alabama. That was like 8 years ago, right? I don't in 13, 14, 2014, I think. And now it's like night and day with my speech.
That's
And
marvelous.
Dionna,
That's
um,
marvelous.
Dr. Taub influenced you so close to your heart that you even want to start your own clinic. I'll give you the opportunity to talk with Dr. Taub about your future dreams.
Now. Well, and they have no intense programs anywhere in New York State, like at all. And I'm like, oh my gosh, I need to start my clinic one day and having the OT, PT, and speech center for brain injury. And I have a business plan already made too.
So
And
Okay,
10, 15 years down the road, Deanna's going to be helping other stroke survivors just like herself.
that's very good. And before you do that, it might be a good idea to come back here. So you just received this as a patient, and you need to probably to be trained to do it as a therapist. There are certain tricks or methods of approach, and so you probably want to come down here and get trained to do it. I'm not sure how long I'll be here.
exactly.
One only lives so long. But Dr. Jitendra Uswate, did you meet Dr. Uswate? Jitendra Uswate?
I think so. I can't remember.
He was here when you were here, but he was, what shall I say, um, in our office suite. He didn't come out and do therapy, and he's a scientist. And after I am no longer at this laboratory, he will be the director. He's now the co-director, and his name is Jitendra Uswate, Uswatte, and you'll want to contact him. I'll tell him after we finish talking, and you you can come down here and spend several weeks learning how to be a CI therapy trainer,
There
therapist.
you go, Deanna. Now you have a reason to go to Alabama.
Exactly. I think the start my clinic, but the not clients, therapists definitely come to your town. Definitely.
Yeah, our experience is that therapists need to be trained.
Yes,
What we do.
exactly. Yes. Exactly.
And it's a small world. When I met Dionna, and a year later, one of my best friends had a stroke too. So Deanna's been an immense inspiration for him as well.
And he had his stroke on the right also. Yeah. Right side. Yeah.
Did you do CI therapy with him?
No. No.
So his stroke was much less severe. His speech center wasn't affected. He can read and
Well,
write.
well,
He's going to regular therapies now. I haven't seen him in a couple weeks, but he definitely is in a way better place than Deanna was.
well, with the intense leg therapy, I am wearing heels again and I am running again too.
Marvelous.
Yeah.
Oh, great.
Not like stick heels, but like the black heel. Yeah.
Did
Just
you have any
saying.
did you have any questions that you think that you want to ask Dr. Taub?
Thank you for sharing your story on Zoom. Yeah.
Deanna, did you have any questions that you wanted to ask?
We lost, I lost your sound for a couple of minutes.
Yeah,
So
whatever
I
you
didn't
just
hear
said didn't
everything
come
you
through.
said.
Oh, I don't know.
Just
Let's
get
see.
closer to.
There.
Yeah,
Thank
that's
you
good.
for sharing this with us. The wonderful to meet you again.
Well,
Oh, what places are doing CI therapy around the US?
how many are doing it?
Yeah.
Some I don't keep track. Uh, we train therapists, but I don't. Dr. David Morris gives workshops and trains therapists here and elsewhere in Brazil, in China, South Korea,
How?
Indonesia. And I think he gave a workshop in Egypt, Israel, and in the United States. So he would know how many clinics are doing CI therapy, but I haven't kept track.
I think, Deanna, isn't Marquette University their new clinic doing CI therapy?
I can't remember actually, but I went to intense therapy there also for my speech. And my mom called them for like working on my hand again. And originally it was like $2,000, but now it was $11,000 because they have real therapists and but not afford that right now. But
But were they doing CI therapy there?
I think so. I can't remember. I think so.
we don't charge that much, but depends on how much treatment time you use and they give. Uh-huh.
Well,
I think the benefit that you have though, Dee, is your right arm and hand is really good. I mean, you use it to what I would say is, I
not
mean, I don't
normal,
know.
but
You use it really well.
well, thank you. Did I met um Tony and Jeannie in Milwaukee, and they went to your clinic for um her uh OT or PT. I can't remember either. And Tony said, wow, that is like a great place. And he said the own therapy up here, well, in Milwaukee. And he did in a couple of years after that therapy. Well, her therapy.
Do you have anything else to that you would like to add or say, Dr. Taub?
No, that's about it.
Well, I appreciate you taking the time. It was absolutely wonderful to hear from you. And Deanna was super excited. So
Yeah,
I
I'm so pleased to have made contact with you again.
yeah, definitely. I am like in awe because I've been, well, I've been there, I've been through it, and helping others is so helpful, basically. And yeah, um, I have a couple of friends went to your clinic too. Yeah.
You sent them there, did you?
Yeah, yeah. Um,
They have a
yeah,
good result?
yeah, definitely.
Oh,
Yeah,
good.
yeah.
That's good. And it's so nice to see your happy face and
Oh,
that you're graduating.
I am almost 25, but I am still going to school, but I have my internship right now. And it's every day, and it's called Hickok Center for Brain Injury. And yeah, I am enjoying it too. Um, yeah,
That's
that's
great. That's great.
well, I will send you the trailer for the documentary as soon as we're done here. And then Deanna wanted to make sure that I mentioned that when this is done, we're having a private premiere here in Rochester, and she wanted to extend an invitation to you. Um, but either way, we'll send you the final thing when it's all done.
Okay.
and Tyler, my mom sent you a thing to tell
It was
Dr.
in the
Taub.
email.
Oh, okay. Okay.
Yeah,
All
give
right.
my regards to your mother.
Yes, thank you.
All righty. Thank you, everybody, for coming.
Thank
Okay.
you.
Bye.
Bye now.